we know that this virus can cause severe and potentially fatal disease in certain individuals who get it. And part of what makes this virus so insidious is that 45% of infections are asymptomatic. And that is why this virus is able to transmit so readily. And we have recently come to learn that children between the ages of 10 and 19 seem to transmit the virus just as effectively as adults do. And it appears that children under the age of 10 transmit the virus about half as effectively as adults. And so that risk has been mitigated up until this time by not having children in school. But obviously, once individuals who potentially can be infected or are asymptomatically infected get into close congregate quarters for extended periods of time, there is a real potential for significant increase in cases, especially as our public health experts tell us our current case counts at this time are about 9 times where they're supposed to be for where we're supposed to be at for safe start for going back to school. There is, at this time, with a lot of community transmission of infections, a real risk of, at this moment, a reservoir within school children in congregate settings leading to significant transmission of infection.
There is nothing like in-person instruction. We know what a difference we make when students are with us. We know that interaction between a teacher and a student, our staff and our students is critical to that relationship. I know how important this is. And it became very apparent that the risk was too great for us to be sending back our students, even for our youngest students. We've asked those questions. We've asked them directly to the health professionals. And from their perspective, the risks are too great. I've seen the same information as everybody else. It's about a 0.1% death rate amongst young people. For our district, that would be roughly 7 students. As a superintendent, many people think that my number one priority is academics. It's not. My number one role and responsibility and my commitment to the board is to ensure the safety and well-being of our students, of our staff, our parents, and the community at large.